viewers, my name is Mapeh and welcome to our first safety adventure. Today, we will be discussing about unintentional injuries, safety, prevention, and first aid. Here are the objectives. Number 1, demonstrates the conduct of primary and secondary survey of the victim. 2, assesses emergency situation for unintentional injuries. 3, explains the principles of wound dressing. 4, demonstrates appropriate bandaging techniques for unintentional injuries. 5, demonstrates proper techniques in carrying and transporting the victim of unintentional injuries. And lastly, demonstrates proper first aid procedures for common unintentional injuries. Let us now define these following terms. First, unintentional injuries. These refer to injuries that are unplanned and typically preventable when proper safety precautions are followed. Prevention, the action of stopping something from happening or arising. Then lastly, you have safety. It is our freedom from danger, risk, or injury. There is a saying that goes, prevention is better than cure. Practicing this principle advocates safety awareness, which is essential in achieving quality of life. No place is considered safe, not even in the comfort of our homes. Accidents may happen at any place, anytime. Thus, taking the right safety measures greatly help prevent accidents and injuries. Nevertheless, when accidents happen, it is important to have knowledge and skills of first aid to deal with them. Now, what do we mean by first aid? First aid is an immediate and temporary care given to a person who suddenly gets ill or injured. Now, let me welcome you to our first safety adventure. Today, you will learn about objectives of first aid. Number 1, to save lives. Number 2, to prolong life. 3, to alleviate suffering. And lastly, to prevent further injury. Characteristics of first aider. We have gentle, observant, resourceful, tactful, and sympathetic. Now, let's move to our second safety adventure. This will be very exciting because you will know the proper procedures in assessing emergency situations for unintentional injuries and in doing the primary and secondary survey of the victims. Step 1. Is anyone in danger? If yes, can the danger be easily managed? If it cannot, call for emergency help and protect the scene. Second, move to the quietest victim and ask if he or she is okay. Third, open the airway so you will use the head tilt chin lift method. Fourth, check the breathing. If breathing, place the victim in the recovery position. If not, pinch the nose, seal your mouth over the victim's mouth and breathe in. Then fifth, look for signs of circulation. If the victim is a drowning child or an adult, proceed directly to CPR. Otherwise, look for signs of life like movement and normal skin color. There are 2 ways to conduct physical examination when giving first aid. First is primary survey of the victim to check if the victim is unconscious and to find out and immediately treat life-threatening conditions. The first thing you should do is to check for consciousness. Ask the victim if he or she is okay, but if there is no response, the victim is unconscious and in need of medical help. Letter B, open the airway. There might be an obstruction on his or her airway that make breathing impossible. Check for breathing. Put your face near the victim's mouth and look, listen and feel for breathing. Chest movement and sound for breathing. Then lastly, check for circulation. So you must locate the pulse using middle and index finger because this indicates blood circulation and it may be reflected on the color of the skin. Remember, pale color means this is fatal, so you must perform CPR immediately. Secondary survey is used when the victim is conscious or has revived. So, history taking in here, you will check the victim's complaints, allergy, the medicines he is currently taking, his previous illness, last meal, events prior to what happened, how long does he feel the pain, where is the pain coming from, what is the severity of the pain, and of course, what stops the pain. Check for vital signs. We have pulse rate, temperature, check the number of breaths per minute. Normally, it takes 15 to 20 breaths per minute for adults, while 40 breaths per minute for babies. Lastly, check the skin color. It should be warm and pink because it's an indicator that blood flows normally in the blood vessels. Let us now have our third safety adventure. This will be a new and exciting trip where you will learn different dressing and bandages used on wounds and burns. So what does dressing mean? It is a piece of sterile cloth that covers a wound to prevent infection or to stop bleeding. Here are the steps in wound dressing. First, wash your hand. Second, wear gloves. Third, clean the wounds. Fourth, apply the dressing. And lastly, fasten it with tape. Next, we have the uses of bandages. It is used to apply pressure to bleeding, for covering wounds and burns, and providing support for immobilization for broken bones, sprains, and strains. Here are examples of bandages. First, triangular bandage. Next, ace bandage and tubular bandage. There are two phases of bandaging. Number 1, open face bandaging. This is used for wounds on top of and back of the head, chest, back, foot, and as arm sling. We have cravat face. This is used for wounds that need extra support like wound on the eye, forehead, ear, cheek, jaw, shoulder, hip, arm, leg, elbow, knee, and sprained ankle. Okay, so let us look on the steps on forehead bandaging. Ear or cheek bandage. Cravat bandaging. Cravat bandage for the eye. Let us now discuss the techniques in bandaging. Number 1, always use a square knot. 2, keep the cloth sterile to avoid infection. And number 3, always keep the ends. Let us now discuss how to carry and transport victims of injuries. Number 1, lover's carry. Next, shoulder drag. Next, fireman's carry. We have blanket drag, fireman's drag, backstrap carry, and chair carry. 2-person arm carry, hammock carry, and bearer alongside carry. Let us now have our last safety adventure, which is the first aid for common and intentional injuries, which will help us practice safety measures and help yourself and loved ones and injury victims during emergencies. First, we have fracture. It is a break or fracture in the bone. First, you must rest. Second, apply ice. Third, compress it with a bandage. And last one, elevate the injured part. Dislocation, separation of two bones where they meet a joint. First, call for help. Second, do not move the injured part. Third one, apply ice to avoid swelling. Sprain and strain. Sprain is caused by torn fibers in a ligament, while strain is a twist, pull or tear in a muscle. First, take some rest. Second, apply ice. Third, use compression. Fourth, elevate the injured part. Heat exhaustion is caused by loss of salt and water due to excessively high temperature. First, have the person lie down. Second, apply cold compresses. Third, use a fan to lower temperature. Fourth, elevate feet. And last one, give fluids. Food poisoning is caused by consuming food or drink that is contaminated with bacteria or virus. First, help the person to lie down and rest. Second, give him plenty of flavorless fluid and a bowl to use if he vomits. 3. Call for medical help if the condition worsens. Heart attack, caused by sudden obstruction of blood supply to the part of the muscles. First, push hard and fast on the center of the victim's heart. Second, tilt the victim's head back and lift the chin to open the airway. 3. Give mouth-to-mouth rescue breaths. Chemical burns occurs when living tissue is damaged by an irritant, usually a strong acid or base. First, pour water for 20 minutes to ensure that there is no contamination from the chemical to other areas of the body. Number 2, cover with sterile cloth. Stroke occurs when the blood supply to part of your brain is interrupted or reduced, preventing brain tissue from getting oxygen and nutrients. Check out for these signs: face drooping, arm weakness, speech difficulty, and when you see the signs, it's time to call for an emergency help. Always remember that accidents may happen at any place, anytime. Your safety is your responsibility. Remember, if you want to live happily, you must do things safely. Once you internalize safety in your system, this influences you to think and act with due regard to your safety and that of others as well. lastly, as we end this safety adventure, let me share to you a powerful quote by